Welcome to the Doctor of Clinical Psychology webinar. My name is Bradley Seifer, and I am the admissions advisor for the PsyD program here at Divine Mercy University. Joining me today is a 2020 PsyD graduate, Dr. Garrett Boyer. And so I'll be asking Dr. Boyer about his own experience here at Divine Mercy and his journey within psychology and after graduation, in addition to the presentation. And then I'll be able to Dr. Boyer and myself will be able to field your questions after the presentation. So if you do have questions, either during the interview or the presentation, please lodge them in the chat box, and we'd be happy to attend to them at the end. In addition, in the chat box, you will also find my email, my Calendly link, my other ways to contact me, also prior webinars and testimonials from previous students in the PsyD program. So please get in touch with me. I'd be happy to meet with you and explore whether the PsyD at Divine Mercy is a good fit for you. So with that, let's get started. So Dr. Boyer, why don't we begin with exploring how exactly did you become interested in clinical psychology in the first place?
Hi, sir. Yeah, thank you so much for having me here today. I'm glad to get this chance to visit with you and to share kind of an overview of my background. I'd always been interested in behavioral health, the science of psychology. When I was in undergrad in North Dakota, where I did seminary studies, I took a psychology class and was really fascinated at the contributions that the discipline of psychology could make and did make. I referenced that I was a seminary student, and I was in the seminary for years and years, got close to ordination before I discerned out. But I realized the importance of psychology as I went along in the seminary, because often when I would visit with people, the things that a lot of folks wrestled with and struggled with were not as much related to spirituality, religion, or theology, but they were really wrestling with behavioral health issues and mental health concerns. And so that was one of the things that I started reflecting on and thinking about as a seminary student. Wow, the stuff that they're working on and working through, I don't really have a lot of the tools or resources or background to help them address some of this stuff. After I discerned out of the seminary, I wasn't exactly sure what direction I was going to take. So I lived and worked in the Washington, D.C. region for a number of years, doing a lot of different things. But it was always in the back of my mind to consider behavioral health, psychology as an option. And so eventually that thought kept coming back, that invitation to explore behavioral health, to explore psychology just wasn't going away. And so I submitted a few different applications. And at the end of the day, I'm thankful that I was accepted and got into Divine Mercy University. It worked out well for me in that I was already living in the Washington, D.C. region. But more importantly, the scope, the mindset, the direction of the school, the way that they conceptualize behavioral health, behavioral science, it really fit in well with me, my own personality, and the way that I wanted to approach the discipline of psychology.
Excellent. Thank you for sharing that, Dr. Boyer. Say then a little bit more about, you mentioned that you were in the DC area and this was also, close by, but expand on why you chose DMU in particular.
Yeah, I think in psychology, there are a lot of different subspecialties. There are a lot of directions you can go. There are a lot of different things you can do as a psychologist. You can do a lot of therapy work. You can specialize in assessment. You can zero in education or consultation. I took the military route. There are a lot of things that you can do with psychology. You can get those skills, that training to be that subject matter expert at a lot of different institutions. The thing that distinguished Divine Mercy University for me, and which I appreciated, was the fact that they approached the discipline and science of psychology, looking at it through a lens of Catholic anthropology. And so I think having that foundation of a well thought out, time tested, true Catholic anthropology, using that as a stepping stone for advancing and approaching and furthering the discipline of psychology was just very appealing, very attractive. One thing that I have observed in behavioral health as I look, say, at the American Psychological Association's publications and magazines, these sorts of things, I get the sense sometimes that behavioral health, field of psychology, sometimes feels like it's kind of clinging to a small raft, bobbing up and down in a stormy ocean. And I never got that sense at Divine Mercy University that we were trying to go at psychology on shaky ground. I think the fact that we have approached psychology that's built on this foundation of the Catholic anthropology, it made studying and reasoning, thinking things through, approaching the science so much better, and just it was an excellent way to go about studying and growing in this discipline.
Excellent. So it sounds like the Catholic anthropology that the school provided, and like you said so well, it was rather well thought out. I mean, there are, as I tell many people with whom I speak with daily, there are many Catholic schools that teach psychology that have wonderful either PsyD or PhD programs. But the unique thing about Divine Mercy, it's like our faculty have compiled an entire volume, the Catholic Christian Meta Model, and as you can see, it's rather substantial. So they've thought about this in a lot of detail in terms of the inner machinations, the interplay between the anthropology on the one hand and the science of psychology on the other. And it sounds, based on your experience, that this has been helpful, for you as a psychologist in the field. Is that fair?
Oh, absolutely. And one thing that was so remarkable about it was after I graduated, I work in the military now, as you can see from my uniform, a thoroughly secular environment. A lot of my people that I graduated with went off and worked in distinctly Catholic settings. That's not the case for the United States military. Nevertheless, the people that I work with on a daily basis, whether it's my peers, my patients, my subordinates, leaders that I consult with, that framework that you find in the Catholic Christian Meta Model of the human person is applicable to everybody. And so it doesn't matter whether I'm approaching my work in a distinguished Catholic way, or whether it's the kind of work that I do as a military psychologist. That framework is equally useful, important, valid, and to me has been very helpful, because the kind of material that you're going to read in the Catholic Christian Meta Model of the human person, it's the story of everybody. We're all sharing in the human experience. We're all striving to be the best version of ourselves. We've been created. We have our struggles, fallen. The Savior has come, and we've been redeemed. Everybody is working that out and experiencing that journey in their own way, their own shape, their own form. And it's been so relevant and useful to conceptualize the human person in that way, because even in the military, even in the most secular of settings, that same kind of dynamic is very, very present. And I'm glad that I can address it and use the kind of language and think it through in a way that I was trained to do at Divine Mercy University.
Excellent. So, Dr. Boyer, it's interesting that you make that point about that use that word, the relevance of the meta model and the import of Christianity for psychology, because maybe ironically, a lot of people with that I talk to daily have kind of the opposite concern, or maybe an attending concern, which is that, how as a person that is trained in a Catholic graduate school of psychology, how will I be able to reach the secular world, the people that aren't religious, and things like that? And it sounds like, well, first of all, that we are all kind of embedded within a similar, or these same, human nature, and that the Catholic anthropology is able to attend to all people. I mean, Catholic being universal, right, in the Greek. Is that an accurate take?
Yeah, for sure. And I think that point that you bring up was certainly something that was relevant, especially when I started at Divine Mercy University. When I first got to school, they had not gotten the APA accreditation, the American Psychological Association accreditation. And so there was concern, and it was a little bit of a risk that myself and my peers all took by applying to this school, because we didn't know for sure that the accreditation would happen. I think we all certainly prayed and hoped that it would, and felt pretty good about the chances. But there was that concern. Well, what happens if, worst case scenario, there is no accreditation? We're going to be pretty limited in what we can do and how we can practice and where we can go. Once the accreditation came, that opened a ton of doors, a lot of opportunities to then go out to parts of the world where previously our students and graduates hadn't been able to go, like the military, for instance. With the APA accreditation, I was able to get an internship and residency in the Army and work as a behavioral health officer for the government.
Excellent. In a way, you've already anticipated one of my other questions, which is relevant to the internship, and how impactful is the internship, for your trajectory as a psychologist. And it sounds like the APA accreditation has allowed you to get a fantastic internship and sort of provided for the career track in which you're on now. Is that right?
Yes, and I will say one thing about my training at Divine Mercy University. Just like any school, just like any kind of training that you participate in, it sets you on a trajectory, but the work isn't done. It's not finished. And is very, very thankful. I'm very fortunate to have the internship experience that I did, because they really tried and tested the training that I had gotten at Divine Mercy University. And I think my formators, my superiors, my military supervisors were all very, very pleased and surprised that a student coming from a school that they hadn't had as much exposure to, Divine Mercy University, that a student could come out of there with the kind of skill set that I had and really fit in and plug in perfectly within the military system. A lot of times, students who come into a military internship come from different schools, secular schools, and that's fine. That's great. I think they were wondering, how is this guy going to fit in? How is he going to work? They knew where I had come from. They knew my background. They read my resume. And so the question that I'm sure they were asking was, is this guy going to be able to deliver? Is he going to be able to give the military, our soldiers, what they need? And not only was I able to do that, I think I distinguished myself from my peers with some of the skill sets that I was able to bring because of the training that I had gotten at Divine Mercy.
Excellent. I want to press this business of the meta model just one step further. So sometimes I hear from graduates such as yourself, when they talk about the impact of the meta model within psychotherapy, they're asking the question, what concrete difference does the meta model make within psychotherapy? And one thing that has come up has been that many clients, in fact, want to discuss religion within the context of psychotherapy. Not all of them, but some of them do. And those of our graduates who've gone through our program and are well acquainted with how to integrate in the discussion of philosophy and theology within psychotherapy has turned out to be a blessing in terms of their comfort and ease of having those conversations with clients. Has that been your experience?
It really has. I never have forced it on any of my patients, on any of my clients, but it has happened so often that it just sort of naturally comes up in the process of therapy. And even in the process of assessment, I do a lot of assessment. It really has been remarkable for me to see how just naturally, as a result of conversation, topics with these sorts of themes come up. Because it's what being a human is all about. We're all experiencing this dynamic of humanity. The fact that we're wrestling through, we're working through, we're progressing, we're on a journey. Sometimes my clients, my patients, folks that I work with will use explicitly Christian or Catholic language. Sometimes they don't, but they're all getting at the same kind of thing, which is that meta model of the human person. This is what it looks like to be made in the image and likeness of God. It means that there's going to be trial. It means there's going to be tribulation. It means there's going to be struggle. It means that we're going to have to journey together and walk this thing through. And it's okay to be on a journey like this. It's just been very, very enlightening to me that so many of the folks that I've worked with have been able to articulate this themselves. And again, like you have mentioned, sir, I'm just grateful that I have the lingo. I know how to address it. I know how to speak about it in a way that is therapeutic, grounded in evidence, and is evidence-based, and ultimately is helpful for my patients and the people that I work with.
Excellent, fantastic. So you've spoken already to the trajectory that your career is on. You've taken the military path, which is fantastic. Can you expand a little bit more about your own sort of clinical and academic interests in psychology and what role that's played in your career?
Yes, I am a military psychologist. I mentioned at the beginning that there are different subspecialties under the umbrella of psychology, and being a military psychologist is most definitely a specialty and a very distinct way of applying the science of psychology. And even in military psychology, there are different avenues that you can take or different kinds of applications that you can have. I referenced at the beginning that in psychology, some of the bigger roles are educator, a teacher, a supervisor, consultant. In the military, what I love about being a military psychologist, and especially the role that I'm in right now, is that I get to do all of those things and so much more on a daily basis. That's one thing that I really have appreciated and enjoyed about the Army, is that you are thrust into environments, circumstances, situations where you're going to have to rely on the training that you got very quickly. So the job I'm in now, for example, on the secular side of psychology, I'm doing the work that somebody who's been in maybe 10 or 15 years after graduation would be doing. In the military, you're going to be thrust into very important positions very quickly because of the needs of the Army, because of the demands of the mission set. And so I find myself in a situation now where I'm responsible for a lot. I've got a lot on my plate. And nevertheless, even with that, I don't feel intimidated. I don't feel scared because I've had excellent training in residency and internship. But even before that, it was all built on that very solid foundation of clinical skills that I picked up while I was studying at Divine Mercy University. So my interests are specifically related to military psychology. I want to make a career of it. I would love to see where it takes me. I mean, the Army can look a lot of different ways. The model that we use generally is called an embedded behavioral health model, which means that the psychologist doesn't sit in the hospital and waits for soldiers to come to him or her. We get embedded with the unit. So if the unit deploys, psychologist deploys too. If the unit goes to a range to practice shooting or goes out to the field for a training exercise, the psychologist is right there with them. So I love that aspect of military psychology. It's the discipline, the science of psychology, but also the super fun hua hua Army soldier stuff. Because that's what happens in the Army. You're a soldier first, an officer second, and then whatever your job is comes third. And that's how I've sort of formed this in my own mind. I'm a soldier first. My first job is soldier. I'm an officer. I lead others. I have responsibilities to others. And then I do my job. And I try my best to do it very, very well. I'm a psychologist. And that means teaching, working with therapy, doing assessments, consulting, all these sorts of things. It's been an awesome journey. I've loved every minute of it. Can't wait to see what's going to happen next.
Fantastic. That does sound exciting. Let's go back though to your time at Divine Mercy for a minute. What would you say would be sort of on the one hand the most enjoyable and rewarding part of your Divine Mercy experience? On the other, what would you say would be sort of the most challenging and the most difficult part of the journey in the PsyD program?
Okay, yeah, I love that question. Do you want me to be perfectly honest or
brutally honest?
Okay, it's not brutal. Well, at times it's been brutal, perhaps. When I was at Divine Mercy University, I met a girl and I ended up getting married to her. And so that was not something I went to school looking for, but that's the way it happened. Actually, there were a number of students while I was in school and then after I left who had gotten married to other students. Kind of interesting how that all works out. So for me, that was a great benefit of being at Divine Mercy University. More towards the question that you're asking about specific kinds of things you'll get at the school. I think one of the things that I found most enjoyable, most interesting, were the different personalities, styles of the professors. We have had, and we still do have at Divine Mercy, top-notch professionals who really are experts in the field. And I had a background doing teaching. And so I just thought it was awesome to go to different classes and see the style, the approach, the technique that different professors used and how they kind of structured their classes and presented. And it's been very helpful for me because as a military psychologist, a big part of my role is teaching, presenting, doing educational kinds of things. So even though it wasn't a formal part of the curriculum, I learned a lot by observing my professors, watching. And so that was one of those things that I really enjoyed about this school, is the diversity of the professors, the way that they were all distinct from one another, and yet each of them just did an excellent job, I thought, in their own way. And I was glad to get to see that. Different challenges. It's graduate school, so it is challenging. And it wouldn't be worth doing if it didn't challenge you, if it didn't stretch you,
right?
Didn't pull you out of your comfort zone a little bit. I think one of the challenges that I had was doing externships. Throughout the course of your time, you'll be expected to participate in externships, which can be at different sites around the Washington, D.C. area. And I had a few externships that were very, very good. I loved them and I grew a lot from them. I think what made it challenging was to take the material that I was getting on externship and connect it to everything that we had been learning at Divine Mercy University. So take, for example, I did an externship at the NIH in Bethesda, and the externship was specifically in neuropsychology.
Oh.
Now, we had been exposed to neuropsychology quite a bit at Divine Mercy University, but it wasn't like the main thrust of our curriculum. We had gotten plenty of exposure to it, but it wasn't like that was our thing all day, every day. But that was the case at the NIH. And so it was a matter of, for me, finding a way to get all of the material that I needed in order to be successful at that externship. So that was one of the challenges, but a very good challenge, a very relevant challenge. I especially was grateful for that opportunity because it became such an important part of the work that I do as a military psychologist. As you can imagine, there's a lot of neuropsychology in military behavioral health, people with traumatic brain injuries, people who jump out of helicopters, hit their heads, people who are exposed to a lot of explosions, gunfire, the vibrations from being in flying aircraft. These sorts of things all have a big impact on brain health. And having that experience at the NIH and being able to take what I had been learning at Divine Mercy University and apply it at the NIH and then carry it forward to what I'm doing now in the military, it's awesome.
Fantastic. Excellent answer. Again, you anticipated another one of my questions, which is about marriage, actually. Because there are lots of prospective students ask this question about, either they are already married or they hope to get married, soon within the next, hopefully, few years. Could you expand on that point a little bit? Because you've gone through it, you've done it, you've got married. It sounds like you got married in graduate school. So to other people that have that concern, or even to speak to the experience of others who were also married, how manageable is it?
Yeah, that's a great question. I think it depends on each individual person. It depends on one's own ability to manage their time, how they go about getting tasks done. Listen, 8 plus 1 is 9, 7 plus 2 is 9, so on and so forth. There are a lot of different ways to get to the end, to get to the right answer. And I think if somebody is looking at graduate school, they're concerned about that work-life balance. They're concerned about the demands of graduate school and other commitments, married life, family life, if that's the state you find yourself in. You're going to have to find what we call in the military your battle rhythm. And it's not something that's out of your reach. It's something that you can work on, get better at. But I think it's going to be a matter of understanding as best you can before you get into grad school. What is the pace going to look like? How is this going to work? Kind of thinking through what your day-to-day might look like. If I'm in class all day, how is this going to impact the time that I get to spend with my spouse or with my children? Am I going to be able to go home? My family is in the Midwest. How often will I be able to fly back and visit family? How am I going to be able to take care of all these other aspects of life? Really, the question of graduate school is the question that anybody else has to ask themselves all the time. How do I balance everything? How do I juggle everything? Graduate school is, in fact, going to be placing a heavy burden on you. It's a lot. And you want it to be, because by the time you finish with graduate school, you want to have the competency to go out into a practice and do the job exceptionally well. So if you're going to be able to do that, you're going to have to carve out the time and find a way to make it work. And that doesn't mean that the rest of life is just going to stop or that everything else is going to be put on pause. You got to find a way to balance, to juggle. The good news is that it's something that a lot of us were able to do. You'll be able to do it as well.
Excellent. Well said. Okay, so what, Dr. Boyer, in your opinion, what would be some very good reasons to do this ID, and what would be some very bad reasons to do this ID?
Okay, yeah, I like that question. And I think that there are more good reasons to do it than bad reasons. One that I have really come to appreciate and love about the work of a psychologist is the expertise that they can bring as an assessor. And so that's one thing that distinguishes psychologists from other counseling professions, whether it be social worker, LPCs, even psychiatrists. We bring a unique skill set of being able to assess to the table. And so Divine Mercy University formed me, I think, exceptionally well and prepared me very well to come right out of grad school and be a very effective and efficient assessor. Personality assessments, intelligence assessments, personnel decisions, all these sorts of things are very relevant and important in the military. And so for me, it was a great idea to do the PsyD program because it gave me that foundation and that expertise as an assessing provider. And so now I can come into an institution like the Army and do complicated psychological assessments, answering very challenging behavioral health questions. Perhaps in the context of therapy, a provider has got a patient and they can't quite put their finger on it. They had this experience, but they're reporting this, and I just don't know what to do with this. It doesn't seem to make a lot of sense. Boom, that's where the psychologist comes in. Here's an assessment battery. Let's do a diagnostic interview. We can iron out some of those questions, provide some clarity, get some guidance, helping the provider, helping the patient. To me, doing the PsyD program is tremendous. And that skill set of being an effective, competent assessor is tremendous. Very good idea to do the PsyD program if you are interested in being an assessor. Are there bad reasons to go into the PsyD program? I don't know that it's necessarily a bad reason, but one thing that it might have an impact is if you've got your own stuff, and everybody does. We all have our own issues that we're working through. I think one thing that can make your experience a little different is that if you're trying to work on your own behavioral health in the midst of school. And there's a sense that we're all kind of doing that because you're learning new stuff. You're taking in new theories, new ideas. I remember very explicitly one course we had, which was sort of an overview of the DSM, the Diagnostic Statistical Manual. Essentially, it's a book which gives you the different behavioral health and mental health diagnoses, and we go through it very thoroughly. And I remember as we were in class, I would read this and I'd be like, oh boy, well, that kind of sounds like me. Or, oh, is this one me? Mine? Oh gosh. There's that sense that we can all sort of identify with some of these issues at various points in our life, but you don't want your own stuff, regardless of how significant it is. If it's really troubling or problematic, or less troubling or problematic, I would be conscientious of how your own personal stuff is fitting into the way that you are training to work with other patients. Fortunately, that's part of what you study is how to manage that, how to keep from projecting your own stuff into the therapy session or onto your clients or patients. So that's just something that I would be conscientious of because I've heard of that happening. Others will get into this discipline because they've thought this might be a way to kind of work through their own issues. I'm not saying you can't do that, but just realize that might have an impact on the way that you approach a study.
Excellent. That's super helpful. All right. Now, what would you say would be maybe one or two, three at the most formative ideas that you learned at Divine Mercy that have been especially impactful in your work as a psychologist today?
Yeah, I like that question. And there are a couple of things that I definitely see on the day to day where I'm like, aha, yep, this links back to what we learned at school. Uh, the first one that I'll say is the idea of attachment,
Hmm.
which is sort of built on the idea that Freud had. In a nutshell, Freud's idea is that um, you're kind of set on a trajectory from the time you're young. And we can deviate a certain way from that. But our early experiences with other people have an influence and impact the way that we're going to get along with others as we go about the course of our life. And so attachment theory came in. It was introduced by a theorist named John Bowlby. And his idea kind of built on Freud's thought, which is that early relationships influence and impact relationships later in life. Well, who has a relationship? Everybody. Nobody lives in a cocoon or in a little bubble. We're all involved in relationships with other people all the time. If you're at home, you've got family. If you're at work, you have peers and colleagues and coworkers. If you're out on the street, you're in a community on the subway. I mean, we're always involved in relationships. And the things we say, the way we think, the things we do, the behaviors we do, the things that we don't do, all of this stuff plays into that equation of how a relationship is going to look and work. And so Bowlby really worked this out, and other theorists as well, Mary Worth, Mary Main, have some great literature on this. But this whole idea of attachment, I see it all the time, every day, because we're all in a relationship with others. So how does that relationship work out? I see it with my soldiers. If they're having problems with their leadership, if a leader is having a problem with their subordinates, one of my soldiers is having difficulties at home with a loved one or spouse, or if they're a junior enlisted with the person they're in the barracks, I always try and get a sense for, well, what do other relationships you have look like? Is this distinguished from other relationships? Is there a pattern of problematic interactions with other people? That idea of how are they attached to other individuals, very useful to understand, very helpful when you're kind of thinking through clinically where we at with this person. So that idea of the relationships, the attachment style, how does that play into where we're at with this patient? So that's one thing that was very helpful that we picked up and learned. Another thing is aspects of personality, aspects of personality functioning. As an assessor, one of the things that we will test for is to get a better sense of what a person's personality is like. What are their traits or customs or habits that kind of go into making up that personality? Different theorists say different things, but a lot of professionals sort of weigh in on 5 big personality factors. Maybe you've heard of them, the big 5. The acronym is OCEAN. So the openness to new experiences or different experiences. Conscientiousness, the level that we're conscientious of ourselves, of others, of our environment. Introversion versus extroversion. And then we've got agreeableness. How agreeable are we? And then finally, neuroticism. And that kind of has a negative connotation to it. But what it's really getting at is particularities. How are we with being a certain way? So with all the personality factors, it's not a matter of right or wrong or good or bad or anything like that. It's a matter of having self-knowledge. Where am I on these scales, on the continuum, say, of openness to new experiences? Where am I? And then how's it going to work, or what will it look like if somebody else that I have a relationship with is maybe on the other side of that continuum? And I see that all the time in the military. There are leadership teams. Perhaps one leader, say, for example, is extremely conscientious, whereas his or her peer may be on the opposite side. There can be some differences of opinion in a case like that. I found it to be very helpful to give some of this education about the personality factors and to help leaders and soldiers understand, hey, it's okay that you're here and that you're over here. And now, how do we reconcile? How is this going to work? How are we going to come together when it comes time to make decisions about this or that or the other thing? So just off the top of my head, those are two big elements that I find myself thinking about every day. The idea of attachment. How are we with our relationships with others? And then the personality aspects, those personality factors. How do those play into the bigger picture? And it's useful for me personally, because I always have to think about my own relationships, my relationship with my family, with my spouse, with my boss, with the people that I am a leader for. I'm always thinking about my own relationships, and I'm always thinking about my own personality. I'm this way. How does that impact somebody else? I may be very gregarious and in your face and sort of that alpha personality. What if there's somebody who's on the other side of that? How are they going to receive me? So it's been useful for me to kind of navigate my own leadership style, my own way of plugging into the military community. But then I see it and I try and coach and teach about it with everybody else that I work with in the Army as well.
Excellent. I love that answer. That gives a nice sort of over just like a few important, impactful points that you learned at Divine Mercy. For those that are who are listening, who are sort of on the fence between psychology and counseling, and they're interested in those points that you just made, namely attachment theory and Freud and Bowlby versus the big five and personality, would you say that those are topics that could be explored just as well in a counseling program, say at the master's level, as in a doctoral level, or is this something that really, to get to plumb the depths of those two realities, you really have to do the doctorate?
I think it depends on what kind of work you're doing as a counselor. I certainly believe the idea of attachment and relationships are relevant across the spectrum of behavioral health. I supervise a lot of social workers. I supervise a lot of LPCs, counselors, and I would be concerned if they weren't able to address issues related to attachment. If they can't work with a service member who's got stuff like that going on, I would have some concerns as a leader and as a supervisor. At the same time, and I alluded to this earlier, there are some things that distinguish a psychologist. I think a psychologist is going to be able to go into those elements of attachment maybe a little deeper, but then certainly the personality factors. I think my counselors, my social workers that I work with in the military are aware of it and maybe have studied it somewhat extensively, but they don't have the expertise to assess for it. They can't interpret a testing instrument with the kind of clarity or expertise that I could bring as a psychologist. And so you may have exposure to this and may even have built up some expertise in these different things as a counselor or as a social worker. But as a doctor of psychology, I can just see it in my own work. I can take these things to a different level that other professionals in my clinic cannot.
Yeah, so it sounds like, say, with the counselor, it's like they might be aware of the big five, they might be able to spot neuroticism or extroversion or conscientiousness or what have you, but you as the psychologist are actually able to carry out those assessments and have a more precise diagnosis of whatever that personality is. Is that right?
Sure. Yeah, we can take it deeper. We can be more precise, be more zeroed in. I think that too, you see things similar in medical models. Doctors, physicians, and nurses do a lot of things similarly, but the scope is somewhat distinct, and they're doing some things in a different way. So it is with the psychologist and the counselor. There's a lot of ways that our disciplines overlap, or the psychologist and a social worker. There are a lot of parallels that can be drawn, and yet sort of the thrust or some of the focuses of a social worker are going to look different than that of a psychologist. And we just bring to the table a very big and relevant piece of the puzzle with the expertise that we get along the way as psychologists when we train.
Fantastic. Excellent answer. Thank you, Dr. Boyer. At this point, let's transition to our slideshow presentation. I'm going to put this up on the for everyone to see. Okay, so as I go through this, I'm going to ask Dr. Boyer to comment in certain places just to sort of get his take on his experience at Divine Mercy, but also to give you all a good take of the whole. So let's get into it here. So Divine Mercy University is a Catholic graduate school of psychology founded in 1999 as the Institute of the Psychological Sciences, and it is dedicated to the scientific study of psychology with a Catholic Christian understanding of the person, marriage, and family. Its expansion from IPS to the Divine Mercy University occurred in 2016 to facilitate growth and add a counseling program at the graduate level. So we are one university. We do have two distinct schools. The School of Counseling offers a master's program in counseling. It is mostly online. And then the Institute of the Psychological Sciences houses both the residential doctorate and the master's in psychology. The doctorate, of course, being entirely residential throughout the year, and the psychology and the MSP being entirely online. So our mission is to provide students with an effective academic and educational environment that supports the integration of the psychological sciences and a Catholic Christian understanding of the person through teaching and learning both knowledge and critical skills. It also assists students intellectually and professionally as they prepare themselves to respond to their vocation as mental health professionals. So we are located outside of Washington, D.C. in Sterling, Virginia. So for those of you who have been to this area, it's truly a wonderful place to work and live and study. We have access to both city life toward the east, toward D.C., about an hour's drive. And then to the west, we have the Appalachian Mountains. So for those of you who are more outdoorsy in interest, we have hiking and canoeing and vineyards and all kinds of things like that. So really, this is a place that has something for everyone, I would say. So as Dr. Boyer had mentioned in our interview, we are fully accredited at every level, including APA accreditation. So we attained APA accreditation in 2016. And so that has, of course, continues to the present day. So as a therapist practitioner, you would be able to perform psychological assessment and testing and diagnosis, journeying with your clients toward flourishing and healing. And as Dr. Boyer had mentioned, the really key distinguishing hallmark of clinical psychology is the ability to assess and diagnose with more precision through psychological assessment, which of course you would be offered ample training in our doctoral program. Now, in terms of the overall structure of the program, it is 5 years in total, okay? So it is 122 credit hours and does include a master's of psychology in passing en route to the doctorate. So after the first 2 years of successful coursework, you would be receiving a master's in psychology degree, and then an additional 3 years for the PsyD. In year one, the main task is the coursework in psychology. Also in the second semester in the first year, you're going to take a dissertation methods class. And so this is the ideal opportunity for you to really kind of think about your dissertation, think about what topic you want to explore and with whom you like to explore it. What faculty member would be most fitting for you to dive into something in a lot of detail, and whatever. And like Dr. Boyer had said, there's, psychology is a massively diversified field. There's so much exciting areas of research that you could become involved. In year two, it's similar to year one. The coursework does continue, though this is sort of your first foray into the world of being a clinician. You'll usually have 2 to 3 clients in your second year on our on-campus clinic here on campus. In years 3 and 4, it does shift somewhat in the sense that you're going to have more time spent in the clinic and somewhat less time spent in the classroom. So in that sense, it resembles medical school, and there's an analogy there in the sense of the shifting nature of how your time is allocated. Now in year 5, this is the internship year to which you'll be applying in year 4. Now being APA accredited, we've had 100% success rate of getting our students into APA accredited internship sites, both this year and in the year before. And I think in the year before that, it was something like 98%. So you getting into a excellent APA accredited internship is very high. Anything you would want to add to the schematic, Dr. Boyer?
I will mention that the sites that our graduates are going to for internships are really excellent, and especially in the last few years, I've seen a diverse number of internship sites where I hadn't even thought a person would go. Baylor University, for example, we've sent students there. The University of North Dakota. So the university setting, private practices, military setting for myself. Some of our students have gone to places that specifically do work with psychological testing. I've just really enjoyed seeing from one year to the next the different kinds of internships that our students get picked up for, and very competitive sites that they should definitely be proud of getting into.
Excellent. So these are some questions of discernment in terms of figuring out whether the PsyD is a good fit for you. So do you want to help people flourish? Are you interested in the science behind human behavior? Do you want to become an instrument of healing for the psychological sciences? Are you interested in performing psychological tests and assessments to diagnose your clients and create a treatment plan? Are you looking to start a career as a licensed mental health professional, and specifically as a clinical psychologist? And do you have the ability and desire to work with all types of clients, from more acute care to more challenging and long-term cases? So if you're thinking yes, 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 then this is probably a good fit. Now, the key areas of competency that we do aim to inculcate in our doctoral program are these. So foundations in psychological science and research, integrity in practice, assessment and diagnosis, therapeutic intervention, professional roles, and then clinical practice from a Catholic and integrative perspective. I'll go through each of these in turn. All right, so the first, foundations in psychological science and research. Graduates will attain foundational psychological science knowledge of biological, cognitive, affective, social, and developmental aspects of the human person, as well as history and systems of psychology, psychological measurement, research design, and statistical method. Graduates will have the skills necessary to conduct their own psychological research. 2, integrity in practice. Graduates be knowledgeable in the areas of diversity and ethics and display critical thinking, self-aware and reflective practice, and self-care. Graduates will demonstrate responsiveness to supervision, collegiality, and professional comportments in professional practice. 3, assessment and diagnosis. Graduates will be able to conduct clinical interviewing, perform intake evaluation, demonstrate knowledge in administration scoring and interpretation of psychological assessments, integrate multiple sources of test data and clinical interview information into a written report, diagnose, and develop a treatment plan. 4, therapeutic intervention. Graduates be able to demonstrate case conceptualization, treatment planning, building, maintain a therapeutic relationship, psychotherapy skills, crisis management of urgent and special circumstances, and discharge planning. 5, professional roles. Graduates be able to function in a variety of required roles of professional psychologists, to include consultant, educator, supervisor, practice manager, and program evaluator. They'll be able to work collaboratively within disciplinary teams and with clients. 6, clinical practice from a Catholic and integrative perspective. Graduates will develop a Catholic understanding of human flourishing and the individual person in marriage and family life, and be able to integrate this with the psychological sciences in clinical practice. Okay, so as we said a number of times today, psychology is very diverse. There are lots of different fields, but for our purposes, for the sake of time, really, I do want to highlight that really the main task of this program is to get you licensed as a clinical psychologist. Okay, and usually what attends this, getting the highest level of academic and clinical training in psychology is oftentimes a position of leadership. Dr. Boyer is, certainly a leader within the military, being an officer, but that's one track. But there are a myriad of others in which you could find yourself involved. You could go into private practice. You could work in a hospital. Dr. Boyer, would you care to mention any other specific settings where you could occupy a position of leadership as a psychologist?
Yes, certainly. One that is some of my peers and colleagues I know have done this, where they'll get involved in formation of seminary students or those in religious life. And so they'll be having the responsibility of perhaps providing counseling, but more so being a consultant to the formators to help them understand the strengths, vulnerabilities of a candidate for the diaconate or priesthood or religious life. And that's a way that, especially within the Catholic community, psychologists can be real leaders and help guide formators in making these decisions about who are going to be the best ones to send forward for the work of ministry.
Thank you. That's helpful. Okay, now in terms of testimonials, we've had really legions of students come through our school and the doctoral program and come out and flourish as clinicians, as psychologists. So these are just a few of many testimonials. So James Walovich has said, in our clinical psychology program, the training is focused on healing the whole person. Kristen Long, I was drawn to the PsyD program as a desire to serve others in a more profound way than my previous positions offered. Timothy White, the school is not afraid to teach you what it means to be human at every level. Psychologically, philosophically, and theologically, that's why I like it. And then Kirsten Curtis, I'm so thankful for DMU. The faculty members are very supportive and received lots of hands-on and clinical experience. Okay, so speaking of military things, this is a video testimonial of one of our current third-year doctoral students, William Johnston, who's done work with PTSD and combat veterans.
Hi, my name is William Johnston, and I'm a PsyD student at Divine Mercy University, currently approaching the end of my third year in the program. Military service runs in my family, and so both my grandparents served, my parents both served. This door, the PsyD program at Divine Mercy University, opened that opportunity for me to continue to give back, to conduct research, and hopefully implement a more robust program to treat PTSD as it relates to combat veterans. DMU has certainly provided the integration that I've sought in terms of my formation, both the philosophy and theology core, in addition to the psychology curriculum, has provided me growth in terms of my faith and my role as a husband and father, and of course a psychological clinician. So in essence, the Catholic Christian meta model of the human person is why I'm here, both for my own sake as well as the sake of my future clients.
We have one other video testimonial. This is from a recently graduated alumna.
I would say that being a student at Divine Mercy University, or DMU, is one of the best things that happens to me. I really appreciate a great support from faculty members and also classmates. I have gained a great deal of knowledge in all aspects of clinical practice, research, and also professional development. DMU not only provides students with strong academic skills, but also prepares them for a career in psychology. I personally benefit from mentorship with academic advisor and clinical supervisors. As a person, what I most appreciate from DMU is that its mission helped broaden my perspectives in understanding a human person through the lens of Catholicism. Catholic principles, especially in hope, love, and faith, are very valuable and certainly helped me become a better clinician.
Now, about our faculty, we have a generalist program in psychology here at Divine Mercy. So what that means is you're going to be exposed to virtually every major field within psychology, everything from developmental, personality, social, the entire spectrum of psychology. In addition to that, you're going to be trained in all the major areas of psychotherapy. Certainly, as Dr. Boyer mentioned, you're going to be trained in attachment theory, but also things like DBT, EFT, IFS, psychodynamic theories, CBT. Really, the whole panoply will be kind of set before you. Let's take a look at a few of these professors. There are many others, but these are just a few samples. So Dr. Lisa Kulicki is our dean and program director. She's a specialist in adolescents, adult, and couples therapy. Dr. Graves is an expert in child and developmental psychology. She's also our assistant program director. Dr. Pecoraro is a specialist in addiction and trauma. These three gentlemen here at the bottom were amongst the founding faculty members of our school back in the late 90s. So Dr. Scarfani is a specialist in CBT and group therapy, Dr. Nordling in child, marriage, and family. Dr. Vitz's work, Dr. Vitz is in fact has retired at the end of this year, though he'll probably return to campus sort of episodically to visit. But really, he played a crucial role in the founding of our school, his work being sort of situated at the nexus between Catholic theology on the one hand and modern psychology on the other. Now, licensing. So is licensing required? Yes, certainly. A license to practice is required by each state or jurisdiction where one might practice as a counselor. When licensing begins after the student has completed the practicum and internship and officially graduates from Divine Mercy, states can and often do have additional and differing requirements. So students are responsible for checking state requirements where they plan to work and adhere to them. These do typically include national and state exams. Divine Mercy will provide general information related to licensure during the student experience. Now, who initiates licensing? Licensing is a student-driven process, so it's important for the student to begin research of licensing requirements in the state that he or she intends to work in as early in the program as possible. Now, will students be fully licensed after graduation? No, graduates must work about a year in a supervised clinical environment in addition to other state requirements to be licensed. And the graduate may be required to obtain a provisional license during this year period, so check your state for individual requirements. Now, these two graphs depict a distinction I like to draw between simply buying something on the one hand, say buying something purely material like a car, in which case the value of that will rapidly depreciate within a few years. By contrast, investing in yourself for education, investing in your own minds, really in your knowledge, to become trained as a clinical psychologist, a field that is very much in high demand with so much mental health issues today in our modern world, the value to it that you will be able to bring to other people is very likely to do precisely the opposite, namely appreciate over the course of your career. Okay, now the investment itself is 1,170 per credit for 122 credits, 142,740 over 5 years. Of course, that doesn't include fees or indirect expenses such as housing, food, gas, that kind of thing. Provided that you feel comfortable moving forward and applying, our financial aid department can provide a lot more information about the financial side of things, but most students do involve federal aid, through certain loans or grants from the government. And the FAFSA form, I do believe, opens for this coming year in October of 2023. Now, to defray costs, however, we do offer students assistantships and work study programs on campus. So for example, if you wanted to, you could work with me and my colleagues here in admissions or in the business office, for example. There are also a number of alternative financing options that financial aid could explain in more detail. But one thing I would like to highlight is this thing called diocesan investments. It's an MOU, a memorandum of understanding through a diocese in the sense that provided that you're a Catholic in good standing at a parish, say you would want to appeal to the diocese and say, hey, you know, I'm starting a doctoral program in psychology at Divine Mercy University. And in many cases, the diocese will offer 15% off of tuition. So that's certainly something that you would want to take advantage of if that fits you. Now, as you can also see, we have a slew of other scholarships that you could take advantage of. And these apply to various demographics, and they pay out in the amount up to the amount indicated here to the right. You can apply to up to 4 of them, receive up to 2 scholarships. And for more information about each of these, you want to visit divinemercy.edu/financial aid. Now, in terms of entrance requirements, we do require a baccalaureate degree from an accredited school. While it's true that we do prefer students who have studied psychology, it's by no means required. So we have had students that have attended and succeeded in all basically academic areas, everything from engineering, math, hard science, to music, arts, English, literature, and everything in between, economics, say. We do also ask for a minimum GPA of 3.0 on a 4.0 scale. If you're close to that, if you're sort of on the cusp of a 3.0, maybe you had like a 2.8 or 2.9 as an undergraduate, talk to me. We can probably find a way to move forward despite that. So let's see what else. Okay, now in terms of the application process, the thing to do, provided that you want to move forward, is to apply online. That's the first step. And once you do so, the financial aid office will get in touch with you. And then after that, we do maintain communication. And then once all the other elements of the application are received and you're competitive, you'll be invited for an interview. Now, there are 3 distinct interviews per year. The first is in November, the second is in January, and the last one is in March. Now that we are having this webinar here at the end of end of May, means that most people listening to this now would want to apply for this one in November. However, I will say that that's the most competitive one for a couple of reasons. The first is that we offer $3,000 off of your first year's tuition if you get admitted into that interview, the early interview. Moreover, this is also the interview where we dole out the most money, the most scholarship money, especially to merit-based applicants. So if you have a GPA of 3.5 or higher, you're eligible for a merit scholarship ranging between 50, and 25% off tuition. So for that reason, this does tend to be the most competitive, but still it's worth applying to and getting into it. All right, now completing your application. So to be considered for admission, you have to get all of these things in before the interview. So for example, part 1, as I mentioned, the online application does include a $55 application fee, but in part 2 includes the following. So essays, we do have 2 essays. The first will ask you about why you want to be a clinical psychologist, why Divine Mercy would be a good fit for you, and vice versa. And then the second asks about your academic and clinical interests within psychology and how you would use those interests in a dissertation. You don't have to have a dissertation worked out, a proposal worked out per se. That doesn't happen until much later, but to get a sense of where you want to go with your research would be very helpful. Also, we do require a resume, an updated resume, and then 3 recommendations. 2 of these recommendations do need to be from academics, so professorial recommendations. If you've been out of school for some time, that's okay. Just make sure that you offer us professional recommendations, say from employers, past employers, present employers, perhaps. But what we don't want here are personal letters from, say, your family, your friends, your therapist, your pastor, unless you work for your pastor. We want professional recommendations or academic recommendations. So Moreover, okay, so official transcripts from post-secondary institutions, we'll need all of those. So if you've gone to graduate school, we'll need those as well. And then the GRE. So we do require the GRE done before you get into the interview. This is the school code, so you definitely, once you get to the test site, want to send your scores to us at this is the school code 5639. If you've taken the GRE within the past 5 years, you won't need to do it again. You can just send those to us, and those should be fine. But beyond 5 years, they're considered dated and they do need to be retaken. Okay. The last thing that I should say about the GRE is it's simply not the most important element of the application. So this is a very common question. A lot of people are nervous about the GRE, not having had, say, math in a long time, 15, 20 years in some cases or more. And just know that while it is required, we really consider the entire applicant. Okay, so everything from first of all, I would say the interview itself is extremely important. How you conduct yourself, your degree of professionalism, your humility, but also your intelligence and your insight and how you respond to questions in the interview is extremely impactful in admissions decisions. But also, of course, they do look at essays, they look at resume, they look at transcripts and recommendations from professors and others. So fear not, if standardized testing is not your can of worms, do not despair. It is one thing among many others, and by no means is the most important thing. So do bear that in mind if that applies to you. Okay, if you are international applicants and you've attained degrees outside the United States, you will need to have your transcript evaluated by a NACIS approved service. And most commonly, this would be a WES.org. So have your course by course evaluation completed through that website. And then if you hold degrees outside the United States, they need to be demonstrated to be at least the American baccalaureate degree. And if they're not in English, they need to be translated into English. And then finally, I would say that if you would consider English to not be your primary language, and by that I mean English being the language that you use for the most part in your personal and professional lives, if that's not you, if it's mostly, say, Spanish or another language, you will need to take the TOEFL test, which is a test of English, or the IELTS, IELTS academic test, and have that sent to us. Okay, that's all I have. So I'm going to take a look at the questions, see what we have here. Okay, so James Slaughter asks, what was that book again? Okay, so that is a Catholic Christian meta model of the person, integration with psychology and mental health practice by Titus, Nordling, and Vitz. So a Catholic Christian meta model of the person. It's sort of like, you might say, a foundational text for, it comes up in many of our classes here. And so it's, for that reason, it's extremely important. Would you have anything else to add to that, Dr. Boyer, about the meta model or the book in general?
Yes, I will say that it's tremendous, and it really is kind of the bedrock upon which the whole approach to psychology at DMU is built upon. So last weekend was the graduation celebration for this year's graduates from Divine Mercy University, and one of the authors of that book, Dr. Paul Vitz, was actually the commencement speaker. So he's been practicing in the field of psychology for decades. And if you had the chance to hear his address, he gave what I thought was one of the most succinct and excellent summaries of psychology, especially in the United States, summarizing what has happened in the last 100 years. The graduation ceremony is on YouTube. If you type in Divine Mercy University graduation 2023, if you fast forward towards the end, you will be able to hear Dr. Vitz's commencement address. And in that address, he relates it and ties it into how it is that at our school, Divine Mercy University, we have the science of psychology has sort of culminated with this approach, the Catholic Christian meta model, and how we can use that now as a springboard to advance and continue to move forward with the discipline of psychology.
Yeah, I couldn't agree more with that. I think that speech is a very distinct summary of a lot of the thrust of Dr. Vitz's work, life's work. You know, for those of you who want to learn more about our school and really its origin, its founding, I highly encourage you to investigate the work of Dr. Paul Vitz, beginning with his first sort of most seminal book, Psychology as a Religion, published in 1977, where he provides sort of, like you might say, an overarching critique of humanistic psychology over the course of the 20th century. But also, you know, if you follow his later work, you know, an article that he published back in, I think, 2005 in First Things, called Psychology and Recovery. And there he sort of expands on what he talks about in this commencement address that Dr. Boyer referenced, namely that psychology as a science, he argues, has gotten a lot healthier. So as it's moved into the 21st century, it's become, you know, a lot more, you might say, realistic and helpful. Do you think that's fair, Dr. Boyer?
No, that's right on. Yeah, and if you have the opportunity to listen to his commencement address, it will be time very, very well spent. Especially if you're considering applying to DMU, that'll provide a very nice snapshot of the kind of environment that you'll be getting into and the kind of work that you'll be beginning as a clinician.
Yeah, good. Okay, so I want to attend to this question. So Jeff asks, what's the difference between a PhD and a PsyD? Dr. Boyer, do you want to take that one?
Yeah, sure. So as I mentioned earlier, there are ways that the field of like social work, for example, and psychology parallel. The same is true with these two kinds of degrees, the PsyD, the PhD. In a lot of ways, especially now, 2023, they look very similar. I think what distinguishes the two is a lot of the research portion. So as a PsyD recipient, I still did a dissertation and I still did a lot of research at Divine Mercy University, which I loved. I thought that was great. But the thrust of the program is to train as a clinician. And so we're practitioner scholars. Both of those are emphasized. If you're getting a PhD in psychology, in all actuality, the training, the process is going to look quite similar, but there'll be perhaps more of an emphasis on the research side. Certainly, if you're wanting to do a psychology degree with the idea of getting into academia specifically, a PhD may be a good way to go. And not that you can't get into academia with a PsyD, you can. Tons of my peers have done it. My spouse has done it. But that PhD piece, there's a different way to emphasize the way they go about research. I hope that helps. Sir, is that kind of your interpretation or your understanding of it as well?
Yeah, that is mine as well. And I think like you said, getting the PsyD doesn't preclude you from having an academic career. In fact, a number of our own faculty have PsyDs, you know, and they carry out research. Though I would say, you know, for example, if you wanted, let's say that you were a person that wanted Divine Mercy for its Catholic character and it's the meta model and what have you, but you also were serious about research and you perhaps wanted to be a professor, the thing to do after the doctorate is to probably do a postdoc, you know, in some area. Let's just say that, you know, Dr. Boyer had referenced his experience in neuroscience, you know, with his externship. That's a particularly hot, you know, area of research in psychology that you would probably need to do a postdoc after the PsyD. But that would, you know, getting a PsyD certainly opens the door to academia, even if research in the program itself doesn't have as much emphasis as a PhD program. Does that sound fair, Dr. Boyer?
Yeah, and I would say in the PsyD program at DMU, you are going to be doing a lot of research. You are going to be writing a dissertation.
Yeah.
It's excellent. And just the way it's distinguished or the way it's approached may look a little bit different from a PhD program. But at the end of the day, a lot of professionals view the PhD and the PsyD generally as synonymous.
Yeah, I'd agree. They're virtually interchangeable. I mean, today I would say, it's true that the PsyD has a more recent vintage. It was created, after the PhD has been around longer. But in today's day and age, they're just each of them are just as good. Okay. Somebody has asked. Okay, so you mentioned 5 years for the program, including the master's. So if someone already has another degree, for example, as myself, I have a medical degree, how long for just the PsyD program? Okay, good. Pretty common question, good question. The thing though is this: we would be able to transfer up to 18 credits of previous graduate work. So let's say if you have a master's in counseling, or even a master's in psychology or things like this, or even if you have a doctoral degree in a related field, we would be able to accept maximally 18 credits. Okay, so that is tantamount to about a semester and some change, roughly speaking, because our semester credits range from 14 to 18 credits, so that's like on the upper end. So truth be told, that's not that much, right? So if it's like some people will ask, should I get a master's degree before I enter the PsyD? It's like, no, like likely you're going to be spending more time and money. But if you already have the degree, we would take that much and no more for the simple reason that we do want to maintain sort of like the integrity of our own program and our own sort of character, such that once you leave our school, you'll have been truly formed by our own program and not that of another. So I hope that answers your question. Okay, good. With that, I will conclude. I'd like to thank Dr. Garrett Boyer for your time. I really enjoyed our conversation, and I think that we explored a lot of great territory that I think will be very helpful for a lot of our prospective students.
Yeah, thank you so much for having me today, sir. I really appreciate getting the opportunity to visit with you and to share a little bit of my own story and my own journey in psychology. If you're considering applying, I'll just leave you with this. There's a widening gap between the folks who need behavioral health services and those who are able to provide it. You are needed in our world today. If this is a step that you are considering take, I highly encourage you to go down this road, explore it, be assured of my support, my prayers, and my appreciation for your willingness to consider this route. And so we're going to say goodbye here, but it's not like a goodbye. It's we'll talk later. By all means, feel free to reach out to me if there's ever anything I can do to support you along your journey.
Excellent. Thank you, Dr. Boyer, and goodbye to you all, and God bless.